Hello and welcome to Dr. Alyssa's Hot Topics on Health. Today I want to give you guys some tips and tricks on birthing and how to have the best birth outcome possible. Now again, this is going to look different for every mom because every mom is going to have a different vision of what birth means to her, and you're going to have a different plan, which is great, but I want to help you have the right people in the right places and have different tips and tricks in order to have that best birth experience. So number one is having the right people in the right places. The top three people I love having on my birth team are a perinatal chiropractor, a midwife, and a doula. This is in addition to your primary care provider, and actually a midwife can take the place of that primary care provider if you so wish. So having a perinatal chiropractor on your team is essential. And again, I speak to this because I am one, but helping moms navigate through that entire birth process as well as through the entire pregnancy is so important, because when you're training for a marathon, you train for months. You just don't go run a marathon. So think of birth as that marathon, and you want to definitely train your body for it. This is where that perinatal chiropractor can come into play and start adjusting you early in your pregnancy in order to allow your body to adapt to the many changes that are going on and allow your body to be ready to have a baby, because it's a big process. The best thing I love about perinatal care for my mamas is working with the pelvis. So the pelvis is actually where your baby comes out. And if the pelvis is not moving well, it can make it harder to push your baby out. I've heard so many times that a doctor told a mom, oh, your pelvis wasn't big enough, or the opening wasn't big enough to allow your baby to come out, which is such BS, you guys. Your pelvis has ligaments on it, including your pubic symphysis, that allows expansion, like ridiculous expansion. And if your body is not expanding appropriately, that tells me something is miscommunicating in your body that's not allowing that process to happen. So again, this is where chiropractic can come into play. Chiropractic can also help with many other things during pregnancy, such as constipation, such as discomfort in your round ligaments, discomfort in the low back, changes in posture because of baby. So chiropractic is essential during pregnancy in order to have the best birth possible. Another technique to look for with your chiropractor is the Webster Technique. Make sure that your chiropractor is certified in the Webster Technique, because the Webster Technique is a specific chiropractic pregnancy protocol that addresses the round ligaments and the pelvis and the sacrum to allow balance in the uterus and allow baby to get into the best position possible. So if your baby is not in a good position, i.e. if your baby is in a breech or a transverse position, the Webster Technique can actually help your baby turn to get into that best position possible. If you need to know more about the Webster Technique, please visit our website. We have more information about it on our website. The other two people to have on your care team is a midwife and a doula. So a midwife and a doula are essential to have on your team because they cater to what you want. When you just have a primary care provider, they're going to cater to what the hospital is telling them they have to do, and they have to follow a lot of rules, which is understandable. A midwife and a doula are really there to follow your rules. And I love that because the birth is your experience and you get to say what you want done when. So having those people on your care team can really help. Other things to do to give your body the best opportunity to give birth is prenatal yoga. Movement, stretching, all of that is great, but yoga is a great way to target pelvic floor muscles, pelvic muscles, uterine muscles, to allow you to push that baby out as easily as possible. A couple other things that help with uterine tone, which again, it's all about the uterus, because the uterus is literally what's holding your baby. And if the uterus is not in good shape, your experience with birth is not going to be the best it could be. Dates. So start eating dates at week 36, because dates are literally the fruit of your uterus. It's amazing. And maybe I said that wrong. Your baby is your fruit of your uterus, but dates help support the uterine tone and uterine tissue. It's amazing. They're literally made for your uterus. So eating 6 to 8 dates a day starting at week 36 can help with uterine tone and help with contractions. Hallelujah. Another thing that can really help is red raspberry leaf tea. I recommend starting this in the second trimester. So start drinking some red raspberry leaf tea to help, again, with uterine tone, uterine contractions, and to help you push that baby out as well as possible. I have so many other things to talk about, but I'm totally getting way too long in this episode. So we are going to do a part 2 series in a couple weeks to finish this up and give you guys a little bit more information about birth and delivery and making it the best it can be.